Hello everyone, I am Dr. Anam Syed. I am a third year gynec resident doing my final year in Syed Hospital. I have been given this opportunity to give you a lecture on cancer, cervical cancer, and how to cope up with it in the current COVID-19 pandemic situation by the Cancer Aid and Research Foundation. This foundation has been striving so hard in this field for nearly a decade now. They've been trying tremendously for management and welfare of cancer patients. I hope they keep continuing their good work in this field. And unfortunately, I was supposed to be giving a live lecture, but due to my duty schedules changing, I could not cope up with it. So here is a recorded lecture. If there are any doubts after the lecture that you come up with, you can always contact the foundation team, and they will get back to me, and I'll get back to you as soon as possible. Okay, so to begin with, cervical cancer. As we all know, cervical cancer is one of the most common cancers in females and globally fourth most common after breast, lung, colorectal cancer. The fact that it can be easily diagnosed and now coming up with new techniques like freezing, burning, it has made it all the more easy for us to understand the nature of the disease and study the history and how the disease progresses. So like how so most one of the most common causes of cervical cancer is squamous cancers. Now the cervix is divided into ectocervix and endocervix. So coming to endocervix is lined by glandular epithelium, with columnar cells, and the ectocervix is lined by the squamous cells. The endocervix is continuation with the uterus, and the ectocervix is the part which is outside, which is seen by us doctors on a per speculum examination. So the zone in which from which the endocervix converts to ectocervix is called the transformation zone, and this transformation zone or the endo-ectocervical zone is actually one of the most common places where cervical cancers develop. Now, before we jump to conclusion of cervical cancer, these cells undergo dysplasia. Dysplasia is abnormal growth, and this abnormal growth is further classified in various uh, mm, classifications before it leads to cancer. This various classifications are these precancerous lesions, which can be where we can interrupt by treatment and prevent invasion into further cancer. So, like in case of cervical cancer, the precancerous lesions are divided into CIN1, CIN2, CIN3. Now, CIN1 is where there is little atypical cells present. CIN2 is where there is most atypical cells present. CIN3 is when atypical cells are present throughout the epithelium, which is just immediate step before it goes into invasive cancer. Now, the thing is with cervical cancer or these precancerous lesions, whenever low-grade cancers like CIN1 are detected, it does not warrant treatment. It can be managed on basis of most of them usually regresses on their own, and its progression to a invasive cancer is very rare. Uh, in cases of CIN2, about according to WHO, around 1 to 2% females do progress to CIN2, and with CIN2, the chances of regression is only 50%. So if it persists after follow up and observing after 2 years or beyond, it might warrant an intervention with the help of excision or ablation techniques. And when it comes to CIN3 is where the chances of invasive cancer can increase up to 50 to 60%, and hence, since it harbors most of the direct immediate precursors to invasive cancer, it warrants immediate management, immediate treatment. Observation is not suggested at this stage, and irrespective of the age of the patient or irrespective of the concerned fertility issues, CIN3 should be managed immediately. Now, how do we manage? Our approaches to control cervical cancer is usually on basis of these two techniques, these two things. One is screening for precancerous lesions. Once you detect amongst any of these stages between CN1, CN2, CN3, you intervene and you can halt the progression to invasive cancer. So that's screening. And second is prevention of invasive cancer by HPV infection. Now, one of the most common causes of cervical cancer is human papillomavirus infection, HPV infection. How do we counter that? So for that we have come up with HPV vaccines. Globally, there are around 3 HPV vaccines available, but there are only two HPV vaccines which are FDA approved in India. That is the Gardasil vaccines, which consist of 4 strains of HPV, and which is a quadrivalent vaccine. And there are Cervarix vaccine, which consists of only 2 strains of HPV, which is 16 and 18, which is actually comprising 60 to 70% cause of cervical cancer. So these vaccines are used to prevent cervical cancer by HPV infection, and they are used at an early stage, usually in earlier younger females from 9 to 25 and 9 to 26 years of age. This is actually advised for both males and females, but currently it is not practiced in males. It is not practiced to give the vaccine in males in India currently, but it is usually preventive in outside countries where it is used for prevention of other genital and anorectal cancers. So these vaccines are recombinant vaccines, which are made up of virus-like particles. So it do not really cause the cancer. It does not consist of live virus particles. Because this is important, because most of the people have the doubt that getting a vaccine can cause you a disease. So no. Its safety measures have been consistently tried with all the random controlled populations, and it is very safe. Now, coming to cancer care. Now, before I start with that, I would first like to introduce you to COVID-19. Yes, we all know about COVID-19, but a small gist about the fact that it was introduced to us in India somewhere in end of Feb or mid-March, and it's a respiratory virus. It's a respiratory virus, and it spreads through droplet infection. We all know the basics, the fact that it has caused us to a lockdown condition, and the fact that it is like any other respiratory virus which gives a similar flu-like symptoms. But what makes it different from other flu is the fact that it is highly contagious, and it spreads rapidly. Hence it has become difficult for us to, the domain of getting hold of the virus is getting a slightly difficult for us as doctors, and hence we are on our way to it. But considering the fact that this virus had caused us a big this lockdown situation had arisen amongst this whole world, has caused certain concerns with cancer patients, especially people who have not been able to follow up or come to the doctor at certain period of time, leading to an advanced stage of the disease, and hence it's a matter of concern. There are certain questions that I have been asked, and I'd like to first clear them. Talking about the risk. Now, there's a question regarding what is the risk of COVID-19 infection in a cancer patient, and the fact that COVID-19 risk does not change whether you are a general population or a cancer patient. But also considering the fact that if you're a cancer patient, and if you get COVID-19 infection, now your immunity is at a little lower level, and hence there's a chance that the severity of infection of COVID-19 would be slightly more in a cancer patient than the general population. But overall perspective, the risk remains the same of catching hold of the disease. Then coming to the next question is, should treatment be delayed? Okay, now this was more significant if this was mid-April going on, and I would have said, okay, now it's an individual approach and you have to delay according to what hospitals are available, and reach out to the hospitals, considering all the possibilities of reaching out to the hospitals and getting specific medications and everything done, would have had certain difficulties back then. But at present, the approach changes since most of the hospitals are working, functioning, most of the doctors are functioning, most of the labs are functioning, and most of the medical medicine providing pharmacies are also functioning. It does not come into picture right now, because delay is not considered important anymore. The delay was important when you were considered when you were advised to stay at home, strictly in the period of the initial lockdown days. At present, I would not advise. And even then, let's say if there's a slow growing cancer like a thyroid cancer, you can wait for another week or two. But in an aggressive cancer, delay can lead to harsh changes, and it's definitely not advised. The next question comes from patients who are already treated. Now, treatment facilities are basically, post-treating patients are now usually asked to follow up, and most of the cancers have their follow-up protocol. Like in case of cervical cancer, if you are in a low grade, if you're detected with low grade lesions, you're asked to follow up at 1 year, 3 year, and 5 year. And most of the cancers have a 5 year follow up protocol. But let's say your timing clashes with this COVID-19 pandemic timing, then I would say if you're asymptomatic, that there is no symptoms which is present from your post treatment phase, then you can definitely go for a telecommunication, like follow up on online. And most of the doctors are available for consultation online. And if the doctor warrants, if the doctor picks up a need to for you to visit the hospital, if there is any complaint that merits a physical treatment or management, then definitely the doctor will ask you to come. Otherwise, most of your follow-up protocols can be done on the local laboratory basis, and the tests and reports can be uploaded for the doctor to review and accordingly managed. So the need for visiting a hospital should be slightly curbed. And yes, I think you should take up telecommunication as an option to prevent you to unnecessarily go to the hospital and acquire or expose yourself to more infection. Now, another question is if there is any special test which can be done to check the immunity. Now, there is no special test as such which can be done to check if your immunity is low or high. But as most of the cancer patients, including patients who are detected with cervical cancer, are on chemotherapy. So when you're on chemotherapy, your immunity is slightly on a toll. Although these patients also receive injection to build and maintain their immunity, but for such patients, we keep doing a constant CBC so that we keep checking for the WBC counts. And through that, definitely you can have a gist of whether your immunity is slightly on the lower side or not. But as such, there's no test for anyone to check whether the immunity is strong or not. You can do a repeat chest x-ray if you're suspecting, if you're having or you developed flu-like infections. But other than that, there is no specific test that you can do at your level to check for your immunity. Next question is about cancer screening. Now, routine screening per se is, you can say, not compulsory, but if you have a predisposition to a particular cancer, like breast cancer, if it runs in the family, or if you have, if you've developed certain um, symptoms like bleeding or abnormally persistent white discharge for a couple of years, and if it warrants, then definitely you should follow the screening program and go for screening. Routine screening per se, as much as possible, avoid going to the hospital. So I would like to say, if the patient is symptomatic, or if there is a predisposition, if you are already a part of a program where you're supposed to visit, where your date clashes or your month of visit clashes with this particular period, then you should definitely go or visit or try telecommunication however possible, for as much as possible. But yeah, the whole point is whether you should continue or whether you should restrict yourself to visiting the hospital when it comes to in a general asymptomatic situation. Yes, you should. If you're asymptomatic, if you're healthy, do not expose yourself to more infection, because screening is done in a healthy population. So in a looking healthy population at least. Unnecessarily exposing yourself in a place which is highly infectious, that is most of the hospitals, then you should avoid that. In case of pregnancy, when I'm talking about cervical cancer screening, yes, it can be avoided again, except the fact that every pregnant female should undergo a per speculum examination the first visit. If it's normal on visual examination, then does not require further screening. But if you detect anything abnormal, then the female should follow a routine screening test with the colposcopy or pap. And yes, so the whole picture sums down to the fact that if you have asymptomatic picture, then you can avoid going for screening for a couple of weeks. You can delay it. If there is anything suspicious about your health that you're concerned with, then continue to follow the routine screening program as per your guidelines, and you should visit the hospital and continue your program. Now, there's another question saying, should I get tested for COVID-19 only because I'm a cancer patient? Now, my answer to that is no. The protocol for testing for COVID-19 remains the same for cancer patient as it is for general population, unless you develop symptoms of respiratory infection, or if there is any sort of complaints of which body ache, malaise, and you feel that it's beyond your persistent illness, you should get a COVID-19 tested. Or if you have any contact from anyone in and around the house, then definitely you should undergo COVID-19. But just the fact that you are a cancer patient does not warrant the need for a COVID-19 testing. The last question, and probably the most important question so far, is how can I prepare myself for COVID-19 infection? Now, again, this is nothing specific to cancer. It remains the same for general population. There are only 3 things that you have to keep in mind, and if you follow this, you definitely are going to be at a safer zone, in a safer zone as compared to the other population. There are 3 things, and please follow them. These are definitely primarily hand sanitization. Now, anything you can use anything with more than 60% alcohol content for hand sanitization, and it is effective, okay, since most of our diseases spread through hand. So hand sanitization plays most important role. The second most important thing is social distancing. Please, it's not only like proven, it's also very helpful for getting infection and preventing transmission of infection. So please maintain social distancing. It is practically possible in most of the places. So please do not go in public crowded places. especially if you're a cancer patient, because like I said, if it does not increases your risk of infection, but if you get the infection, the chances of severity is slightly on the more side. So since you already have a comorbidity, it makes you more, predisposed to other complications in the body. So avoid going to public places or crowded places. And the last but not the least is wearing a mask. You can not uh, disregard the use of a mask in a disease that spreads through droplet infection. So definitely the mask is important, and you're supposed to wear a mask. It not only prevents transmission, but also helps you control the disease by getting it. So works both ways. And a triple layer mask or an N95 mask would be recommended, but that is more for people who are dealing with the, like us healthcare workers who are dealing with it. Cloth based mask, anything which covers your nose and mouth adequately, can be used as a mask for prevention of COVID-19 infection. Now, if you follow these three simple basic guidelines, it will not only help you to combat with this infection, and also help you combat with many other respiratory infections due to allergens in the atmosphere. And it will help you get away with this um, stress of getting the infection easily. So other than that, I think I'm almost done with solving most of your questions. But if there is still something that comes to your mind, or you want to ask me, you can definitely contact me. As I earlier said, contact the foundation team. They will definitely get back to me, and I will get back to you as soon as possible. Thank you for patiently listening to me, and have a nice day.